We're the largest single-site maternity hospital in the UK. We also provide actually the largest IVF facility in the entirety of Europe. So every year we see around about 8,600 ladies give birth here in the hospital, but we look after a far greater population across the northwest of England. We specifically concentrate in providing high-risk services, so we're the high-risk birthing centre for the northwest of England. So we have patients from quite a large catchment area come into the hospital. Like any other hospital, we have financial pressures, we have operational pressures, and we very clearly thought there were opportunities in outpatients as an area of service for us to improve the experience for our patients, both through technology and through greater wayfinding and information. So clearly we explored the marketplace, we looked at providers around the country, and by far and away it was clear that InTouch were both a market leader. They had a number of installations both locally and nationally of noticeable size and complexity that had been established for several years, so they got a track record of a brand solution. From day one, the partnership that we formed with InTouch has been hugely rich and hugely beneficial, both for us as an organisation but ultimately for all of our patients accessing our services. So InTouch invested a great deal of time here on site, speaking to not only myself but service users, speaking to clinical teams about what they needed as a solution for the product. All of my clinicians will say that actually the most frustrating aspect of working with patients is when they don't have complete pictures, they don't have complete records. So putting our outpatient flow system onto a computerised technological basis, allowing clinicians to have information straight to their hands, allowing a clinician to know within their consulting room that that patient is back from outpatient x-ray and is available for them to see, improves their productivity, improves the information they have available to them, and allows them to manage and care for that patient in the most holistic manner. So we've made some very visible changes to our services in support of self-checking technology. So historically, had you come here as a patient maybe 5 months ago, you could have checked in at any one of 11 reception desks. Now we only have 3 reception desks in the building. We've created environments where patients are naturally corralled towards self-checking machinery, where your natural disposition is to self-check in and then default to a receptionist, not the other way around. So patients flow into the organisation. They're provided information both from self-check-in screens and the smart display screens around the site in a very appropriate fashion. It's very discreet, it's very clear where they need to go. The wayfinding's been improved, and you just notice as you walk around our outpatient department a level of calm that wasn't there before. So we don't have large queues waiting to check in with a physical receptionist. Physical receptionists are still an option, but they're greatly slimmed down. Patients are very visibly electing to utilise technology. Patients seem very happy to use the technology, very intuitive. We provide services to a large ethnic minority population. They can use the language options on the self-technology without any problems at all. We've had very good feedback from a whole range of patient groups. And we naturally now see within our outpatient waiting environments patients waiting for far less time, moving through the system in a far more managed, controlled fashion. As Liverpool Women's Hospital, we're not unique. There are many hospitals around the country that have significant cost pressures, significant patient demand pressures placed upon them, and those are growing exponentially year on year. What we've tried to create here is a level of technology that allows both for cost saving, for quality improvement, but equally for expansion. So today we're seeing 170,000 patients a year. We may well see that number increase in future years. We anticipate to do so. The technology that we've introduced into the organisation allows further tens of thousands of patients to be administered without any additional cost to the organisation. That has to be a benefit to the wider NHS. It's always easier doing any level of transformational business with companies that understand your need and genuinely understand your need. Now, we're a specialist organisation, we're a specialist ladies hospital. We look after a whole spectrum of women and newborn children. We like to pride ourselves on the very specialist elements of care that we provide. Therefore, we were equally attracted to work with a specialist in terms of outpatient flow, data management, to enhance the richness of the quality of our service. We were absolutely attracted to work with InTouch because of that. They've got a brilliant product, a really strong brand, and a very evidenceable track record of quality delivery with partners across the NHS.